What are the side effects from hair transplant? First, most common side effect is the swelling. Especially if you got a lot of work done in your hairline, there's going to be a big possibility that you will swell starting from forehead, and because of the gravity, it will travel down to your eye area, cheek area, but it will eventually go away on its own. You're not going to feel any pain from it, but you will just look funny from it. It's just all part of a normal healing process that you don't have to worry about. So number two, another possible side effect could be the itchiness. This could be happen not right after the surgery, but it may happen during any healing up process, meaning anytime between from 1 week to a month. It's just all normal part of healing process, and itchiness can be controlled if you use saline spray time to time, and it will definitely help you with itchiness. But once you're all healed up, it will go away. The third, another possibility of the side effect could be a pain. But normally, most of the patients do okay with over-the-counter drug such as Tylenol, and the pain actually is really worse during the either first or second day, but after a couple of days, usually they are okay.
So some people can experience numbness after the procedure. This is a slight numbness. It's not very prominent at all, and it doesn't last very long. Usually the numbness stems from the injections either of the local anesthesia, making these micro little punctures in the scalp, or the placement of the hair follicles themselves. But it passes in very short amount of time, 3-4 days, numbness is gone. So a question with hair transplantation is there scarring? With the FUE technique that we use, the follicular unit extraction, there's virtually no scarring whatsoever. There will be little lumps, almost like pimples on your head from the actual grafts themselves. When they smooth out and the hair starts to grow, those little lumpy things almost feels like an acne, if you will, disappear. And there's no scarring to speak of with the follicular technique. So there are some other very temporary side effects that can occur.
Shock loss can happen anytime between 1 and 4 weeks after the surgery. Just being because they are so stressful, the grafts, a possibility that the hair might fall out. But you still have the follicles under your skin, so new hair will grow. So even the shock loss happen, nothing to worry about because you will have new hair come out.
So some people ask about cysts or cyst formation after the procedure. They're really not cysts that may form, almost like pimples. In other words, if you can think of an ingrown hair, some of the hair follicles will redirect into the scalp and form a little micro pimple that is temporary and will go away. And again, that may happen, but it's very sparse. You may get one region of, let's say, a couple thousand grafts, one on one side of your head, perhaps another on the other side, and they go away. Another question that comes up is, will there be throbbing? So throbbing is kind of a continuum along the pain scale, if you will. So remember that you had injections into your scalp with the local anesthesia. That's going to be inflammatory. It's going to cause an inflammation. Most of the byproducts of inflammation include throbbing, so you may get some of that. And again, that'll be present for the first 2 to 3 days, and that throbbing will go away. It's not intense throbbing. It's mild, and it makes you know that you had a procedure done.
So post-operative tips to deal with any side effects from the hair transplant.
Okay, some of the tips we recommend come in our post-operative instructions. They're pretty simple things. A lot of them are common sense. For example, we want people to rest when they go to sleep, to be inclined a little bit to minimize swelling. They're told to stay away from intensive exercise like going to the gym for 7 to 10 days. They're told, of course, not to pick at the little scabs that will be present in the scalp because they can dislodge the hair follicles, the transplantations that way. Take the medicines as prescribed. The antibiotics we use Preventively, infection rates are really low, but we use it anyhow. And as far as pain control, they can use anything over the counter. As mentioned before, they can use Tylenol. They can also use ibuprofen in small doses. We don't want high doses, which could induce some bleeding. And if they'd like a narcotic-based medicine, because pain is variable, some people will just need over-the-counter and some will need a more intensive pain medicine, just because we have different pain thresholds. Then we'll prescribe a narcotic-based medicine for them, such as Percocet or Tylenol with codeine. But it's more rare to need a narcotic after this procedure.
When should you go see your doctor if you see any side effects? Basically, if you are experiencing any uncomfortable symptoms such as swelling or high temperature, you should call us right away so we can take a look and see what's going on.
So one method to communicate us if you have any concerns about any side effects that are unusual to you is to take a photograph. Take a photograph, for example, of swelling, send it to us, text it to us. We'll look at it and we'll tell you if that's a normal amount of swelling or something that we're concerned about. And if we're concerned about it, we're going to diagnose what the problem is and we'll treat it appropriately. If you want to know more about hair transplantation, check out the playlist in the description.